First of all, I want to announce that I got a new pelvis. So this is my old pelvis, and take a guess at what's different about this pelvis. And you're correct, it's just that this one has femurs. And I think this is going to be really exciting for the next few months as we dive back into curling, because what I want to talk about in this little run through here, this little video here, is going to go through the different motions that are available to the big thigh bone, the big femur bone at the pelvis. Okay, now we did do a whole podcast on this, so I'll link this below as well. I hope you give it a listen, but I know a lot of people are visual and I've gotten a few questions to dive in a little bit deeper. So we're just gonna go really simply, what are the movements of the femur bone at the pelvis? Okay, and roughly how does that influence your curling delivery? And you absolutely guessed it, my dog is trying to chew a bone at my toes. So here we go. First thing I want to point out that I love about this pelvis is that it's gonna be so much easier to show you that there is this ball and socket joint, okay, within our pelvis. So right here at the hip, okay, you can feel this part of the hip, that bony protuberance, that greater trochanter. And then we've got this ball and socket joint, which gives us so many different movement options. So if you're looking for hip mobility, this is one of the things we're trying to improve, alongside getting those iliums to move and have proper sacral nutation and counter nutation. Videos for another day. So what's really cool about this ball and socket joint is it gives us lots of different movement options in comparison to the knee. Okay, the knee really just has one primary movement. There is for sure some rotation there happening. There's rotation at every single joint, every single movement. The knee and the elbow are hinge joints. You can actually see the hinge kind of like in your doorway. So it kind of limits the options that are available to them, but the hip is pretty cool because it gives us so many more options for movement. And that's what we're going to talk about now. So when you take your femur bone, your big thigh bone, and you raise it forward, so this is midline, raise it forward or bring it up into a march, we're increasing this angle, decreasing this angle, which is called flexion. When we lower the femur bone, that is the start of extension. So we're turning to the midline and extending past, okay? And what you can do within that hip socket without having to tilt the pelvis forward, that's actually your true extension, okay? So we've got raising the leg up, lowering the leg down, and maybe kicking it back, flexion and extension. Now, here's my midline. If I take this leg out to the side, it is called abduction, and I remember it as abduction because it is going away from my body and is becoming absent from my body. To bring that leg in is called adduction, adduction. I'm adding to my midline. Okay, the last movement that we're going to pay attention to is internal and external rotation. So if you think back to the difference between that hinge joint is the fact that I can actually rotate, okay, the femur bone within the socket. So I find the easiest way to pay attention to this and utilize this, or think about this when it comes to curling, is if I bring my leg up into flexion, okay, kind of like in the curling delivery, and then I take my femur bone and I rotate it. Okay, rotating it side to side like this. When I rotate it towards the middle of my body to my inside, it's called internal rotation. When I rotate it out away from my body, it's called external rotation. Now here's the cool thing. So here's a little recap. Flexion, so we got flexion and extension, abduction and adduction, and then internal and external rotation, okay? Here's the cool thing. These motions don't happen individually. I will admit, way back when I first started studying this stuff, I thought if you flexed, you're only flexing. You can't flex and abduct. You can't flex and externally rotate, okay? And I would think of it in this kind of one-dimensional world. Next, I worked on flexion and extension at the hip, okay? Next, I really focused on, okay, I really need to use this glute muscle to stabilize myself in my very deep curling slide. So I did all the clamshells in the world, mini band walks, etc., because I wanted to work on abduction. Now, I didn't really pay attention to extension, and I didn't really pay attention to internal rotation, but we're gonna get to that. Now, I've recognized, I'm sorry, my floor is really kind of squeaky there. Now I've recognized that every single movement doesn't happen in isolation. So when I flex my thigh bone, when I bring my femur bone up, we are not just flexing. There's also a little bit of abduction away from midline, and there's also a little bit of external rotation going to that deep end range hip flexor, which means I can't go any further. When I'm extending my leg, okay, so I'm just gonna flex this side just so we can get a little bit more extension here. When I'm extending that leg back, there's actually a little bit of internal rotation, okay? There's actually a little bit of adduction towards midline. So I'm rotating in and bringing it toward the midline when I'm sending that leg back. Okay, now there is something called your squat and lower body arc, which means at different levels of hip flexion, your body is going to require more internal or external rotation. So very quickly with that, at the top of your squat, okay, at the top of your squat, you're going to have more abduction, your legs are going to move out. You're going to have more external rotation, your femur bones are going to roll out. And at the very bottom, same thing. Okay, in the middle, however, in the middle of our squat, kind of closer to parallel, our femur bones are rotating inwards. There's a little bit of adduction. So how many of you at some point in the last 10, 20 years, when you went to squat, your knees came in before you came up and your coach went, no? We don't stop you from doing that anymore because that's accessing your normal range of hip flexion. You're accessing the external rotation at the top and bottom and the internal rotation in the middle. Okay, now, what does this matter for curlers? I think it's important that we recognize that we're not just bringing this leg up, we're not just kicking this leg back. We also have to access external and internal rotation, especially in deep hip flexion. So this would be my thigh bone at parallel, kind of like at the bottom of the squat. So at this point, I need to access more internal rotation, which actually looks like I'm sending this left hip back. But if I were to stay externally rotated like I was at a higher portion of hip flexion, so a less decreased angle, okay, then my pelvis would remain facing, in my case, to the right. So at this point in hip flexion, I need to access adduction, internal rotation, and that's going to allow me to get lower in my slide. And fun fact, at the very, very bottom of deep, deep hip flexion, we need to actually start to access external rotation and a little bit of abduction. Now, everything that you need as a human is a little bit different. All bodies are different. Some are going to struggle to get internal rotation. Some are going to struggle to external rotation. Some are going to have a hard time finding deeper hip flexion, likely from lack of internal or external rotation. And some people are actually going to be limited by what's happening at the opposite pelvis. Now, all we've talked about are those bones moving relative to the femurs. The femur, I'm talking about as if the femurs stayed stable. We're not even diving into anterior and posterior pelvic tilt, or one pelvis has more external rotation already than the other, okay? So all I want you to take away from this is you got to learn what the different movements were at the pelvis. You recognize that when we bring that leg into a sliding position, we access not just deep hip flexion, but external rotation and abduction. At a little bit higher, we need adduction and internal rotation to help square the pelvis. And this hip needs to access internal rotation. It needs to roll inwards in order to allow us to access that external rotation. I'm going to show you what that means from behind because I think that's kind of cool and it helps to square some people's hips up. Okay, so sometimes even if you don't have the inside of your trailing foot on the ice, I'm just going to show you what that might look like. Okay, so if I'm trying to open up this pelvis, but I can't, this hip is open this way. Okay, pelvis is aimed this way, this hip is open this way. Even if I'm able to square myself up, that's fine. What I want is this femur bone to rotate inwards. Internal rotation with extension, and that's going to allow us, it's going to give us more space for external rotation in that deep lunge, which is going to allow us to access more hip flexion and overall more stability, accuracy, weight control, and my absolute favorite decrease chance of injury. So let me know how that goes. Listen to the podcast episode that goes with this. And I'm super pumped to dive into this more. So if there's coaches or athletes out there that are like, let's chat, this is kind of cool, I have some ideas, please don't hesitate to comment on this post, or email me at steph@empoweredperformance.ca. Please, supportive comments only. And I'm happy to discuss.